My name is Katie, I'm 24 years old, and I was a cheerleader for 8 years. Part of cheerleading, you do stunting, which you put girls up in the air, and then you do tumbling, which is flips. So throughout the years, I definitely had some smaller injuries. I've always had the pain in the left wrist, and I always thought it would go away. I would wear a brace, and I just sort of ignored it. It wasn't until about 2 years after I stopped cheerleading until I realized that it was still hurting, and that's when I knew I should probably get some help.
I first met Katie when she came to St. Luke's experiencing pain in her left wrist. She had pain in the dorsal or back side of the wrist, particularly with what we call wrist extension and with pressure.
The first thing that we were going to do was try to do physical therapy to see if that could help heal the pain I was experiencing.
Katie came to us for a few weeks of conservative treatment to see if that would help decrease her pain and increase her functionality in life. Katie ended up exhausting therapy. We just were finding that the conservative treatment wasn't working. So she did go back to Dr. Matullo for imaging.
We found that there was a partial tear in my TFCC ligament. It wasn't torn all the way, but it tore up enough to create that pain. So that's when we decided surgery would be the right option for me. The day of surgery, I went in the morning. It was early. I was a little nervous, but then I was met by Dr. Matullo before I went under, which made me feel very calm. I knew I was in good hands.
Katie underwent a diagnostic and therapeutic wrist arthroscopy. We put 2 or 4 incisions on the back side of the wrist, and a small camera is introduced into the wrist. During that procedure, we can actually look at all of the bones and ligaments within the wrist itself. For Katie, in her case, the tear of that scapholunate ligament was not a complete tear and didn't involve the structurally important portion of that ligament. We could go in and just simply debride and clean that area up, rather than Katie having to undergo a large reconstructive procedure for her wrist.
Post-surgery, I'm feeling really good. We decided that I needed to do occupational therapy, where I worked with my therapist on the range of motion of my wrist.
Physical therapy really focuses on the injury. Occupational therapy is about treating the whole person, not just their injury. And so in that, we look at your daily life, what you need to do, what you have to do, that type of thing, in order to get you back to where you need to be. We did therapeutic activity and therapeutic exercise in order to increase her fine motor skills, increase her strength, and just increase all the motions that she does in her daily life. Katie's progress has been really great, and I do expect her to make a full recovery.
I knew that I wanted to get help at St. Luke's because they have a really great orthopedic program. Dr. Matullo is so full of knowledge. He's such a great surgeon, and he really cares about you and explains everything to you throughout the whole process.
Having worked at St. Luke's for the last 9.5 years, I truly believe that we're one of the best places for orthopedic care. The ability to meet your patients and then design a treatment course that's not solely focused on how quickly can we get a patient to the operating room, but truly trying to make the best decision for each individual patient for what they need is what we strive for here at St. Luke's. And I really think that we fulfill that mission and we provide the best quality care that we can.
Like what you saw? Be sure to subscribe to our channel so you never miss another video.
To see more of The Peak TV, check out our website, subscribe to our YouTube channel, and catch us on WFMZ Channel 69.